Underneath the ear here, we have the parotid gland. You need to clean this out a little bit more. You have your submaxillary, and in here you have your sublingual. Okay. We have incisors, canines, premolars, and all the way back here would be the molars. Hard palate, soft palate. The tongue, the main muscle is the genioglossa. Underneath the tongue, we have the lingual frenulum. On the surface, we have the spines, and between the spines, we have papillae. Okay. Right here is your larynx. The cartilage piece on top is the thyroid. The lower one is the cricoid. On either side, you have, here's a piece here, thyroid gland, and here's a piece over here. We have the trachea. Underneath the trachea, we have the esophagus. Okay, going down here, this is the diaphragm. Everything above the diaphragm is the thoracic cavity. You have your parietal pleura against the body wall, visceral pleura on top of the lungs. This is the thymus gland right here. Looking at the lungs, on the right side, we have the right anterior lobe, the right medial lobe, and you have the right posterior lobe, and that's divided into a lateral section, which is bigger, and the medial section, which is in the very center. On the left side, I have the left anterior lobe, the left medial, I'm sorry, I was off. Left anterior, left medial, and one left posterior lobe. Okay. Underneath here, we have the heart. The sac around the heart, and you did take it off. This would be your parietal pericardium. The visceral pericardium would be on the heart itself. You can see the auricles, those little flaps I talked about. There's one, and if you turn it around, the other one, there's the other one under there. And this is the apex of the heart. Okay, I don't want you to cut it open. Go down below the diaphragm, abdominal pelvic cavity. The main membrane here is peritoneum. Visceral peritoneum, it would be on the organs like the liver, the stomach, the intestines. Parietal peritoneum would be against the body wall. Now, let's take a look at some of these extensions. This would be your greater omentum. Connecting the liver to the stomach would be the lesser omentum. In between the loops of the intestine would be mesentery. And the mesocolon, I would not ask you, but it would have been back here. Okay. Underneath the diaphragm, the first very large organ here is the liver. You have the falciform ligament, which is attached to the diaphragm and divides the liver into right and left sides. Okay. Cat liver has a lot of lobes. This huge thing here is the right medial lobe, all of it. The right lateral lobe are these two pieces right here. Okay. On the right medial lobe here, you can see the gallbladder. Coming off the gallbladder, I can see the cystic duct. I think the other ducts are better served on the models. Okay. Left medial lobe right here, fairly large here. It's got a little growth on there. Left lateral lobe. And the caudate lobe is this little piece here that sits underneath the lesser omentum. Okay. Underneath here, we have the stomach. Thank you. Cardiac parts at the very top. This would be the fundus, this would be the body, this would be the pylorus. Greater curvature, lesser curvature, the rugae are inside. I can live with that. If I lift the greater omentum up under the stomach, I should be able to see the pancreas. Okay. The head of the pancreas is right here. This would be the body. Over here would be the tail. Pancreatic duct, I would ask on the model. You could fight with me too much about it. Okay, over here on the left side, I have the spleen. Mr. Brady likes to call it the dog tongue. Personally, I think it's a great way to remember it. Okay, coming off the stomach, I have the first part of the small intestine, which is the duodenum. It's sort of straight. Then when it starts to coil, I would call this jejunum. I would call the latter part the ileum. If I want to be definitive about ileum, I should be able to see it that this is the large intestine, so this is definitely ileum. The large intestine is larger. I have cecum, ascending colon, transverse colon, descending colon, and down here would be rectum. Okay, now we have kidneys, one on each side. Okay, coming off the kidney. You could clean these better, but this would be your ureter on each side. This would be the urinary bladder. I think you need to clean this out to see the urethra, but the urethra would be right there. Okay? I'm trying to see. I'm not sure what this cat was. So we're not going to worry about male or female. Okay. Now, blood vessels. Okay, let's do the aortic arch right here. I would call this the thoracic aorta. Just be careful, I'm up above the diaphragm. First branch off the aorta here, this would be the brachiocephalic artery. This would be your left subclavian artery. Over here, the brachiocephalic is going to branch again. This isn't a great example, but this would be your right subclavian right here. And these would be your common carotids. I think it's better on this side. I can see the left subclavian coming over. It becomes the axillary, and down here would be the brachial. Okay. Subscapular. I'll be honest, I probably would not ask it on this cat because I've seen better subscapulars, but it should come off in there. Okay. Now if you look at the veins, I would have superior vena cava. The brachiocephalic is right here. It's sort of like that U part. Then you're going to have right and left subclavians. The subclavians are going to become the axillary, and then down here the axillary would become the brachial. And subscapular, you do have a very nice subscapular vein. It's lovely. The artery just isn't good in there. Then you come up, you have external jugulars. You don't have your internals, but they'd run along your carotid. You do have your transverse jugular. And you have a really nice transverse scapular. And here's the artery. See it? Transverse scapular artery, transverse scapular vein. The other thing here would be the azygos, which you didn't clean out. But see it right there? That's the azygos vein going down. Okay, below the diaphragm. I'm going to smell like cat. Okay, I have, I could clean this a little more. This is your abdominal aorta down here. These are nice though. The first one is the celiac, the second one's the superior mesenteric, and that's an inferior mesenteric. I'd clean some of this out a little more.
I just didn't look at those.
Yeah. This is the inferior vena cava. Then the rest, let's take them together. Renal vein, renal artery. Adrenal lumbar, artery and vein. Iliolumbar, artery and vein. What I don't have a hard time seeing on here is where they split. You need to clean this a little more. Because where they come down and they make the split here, okay, this is the external iliac artery, and underneath it would be the external iliac vein. And this would be the internal iliac. I would only ask the artery. I would like to see this cleaned out more directly to the, oh, you are better here, to the leg. As soon as you come out here, we have a femoral artery and a femoral vein. And in here, that's your deep femoral right there. Then it's going to come down here. You sort of lose it a little bit down here, but I have seen on some of the cats, the one going behind the knee, there you are. That would be your popliteal right down there. And you don't have a good saphenous, but that's what's left of your saphenous. Okay?
Okay.
I think that's I don't think I missed anything. Okay.